Hi, it's Dr. Maria Lee. There's been media coverage in the past that the oral contraceptive pill causes blood clots. Today, we're here to discuss the science behind that claim. The question, does the pill increase the risk of blood clots, is a loaded question. It's like asking, does driving a car increase the risk of being in a car accident? The answer is yes, but there's a lot more to the story than that. Firstly, some definitions. When I say blood clots in this video, I'm referring either to deep vein thrombosis, or DVT, or pulmonary embolism, also known as PE. DVTs are blood clots which form in the veins of our legs. They can cause pain and swelling in the leg, ankle, or foot, but occasionally they can have no symptoms. PEs occur when DVTs travel from the veins of our legs and lodge in our lungs. PEs can cause chest pain, dizziness, shortness of breath, cough, and loss of consciousness. PEs are very dangerous and occasionally fatal. With that in mind, let's answer the question, does the pill increase the risk of blood clots? The answer is yes, slightly. Women who use estrogen-containing contraceptives have a 2 to 4-fold increase in their risk of blood clots. Estrogen-containing contraceptives include most pills on the market, as well as the vaginal contraceptive ring, which is sold as NuvaRing in Australia. However, let me give you some perspective on what that 2 to 4-fold increase in risk actually means. If we look at 10,000 women who don't take the pill, 4 of them will develop a blood clot in a year. If those 10,000 women started taking the pill the following year, up to 10 of them would develop a blood clot. But here's the interesting bit. If all of those 10,000 women became pregnant, up to 30 of them would develop a blood clot. And if they gave birth, up to 65 of them would develop a blood clot. Put another way, taking the pill increases our risk of blood clots from 0.04% per year to 0.1%. However, getting pregnant increases that risk to 0.3%, and giving birth takes that risk up again to 0.6%. This data tells us a couple of things. Firstly, although the pill does slightly increase the risk of blood clots, the absolute risk is still very small. And secondly, normal life events like pregnancy and birth give us a much higher risk of blood clots than taking the pill would. Additionally, the pill is not the only thing that increases the risk of blood clots. Things like smoking, surgery, cancer, family history, and long-distance travel also increase the risk of blood clots, and your doctor will go through these with you before they decide whether you should take the pill. Of course, the pill isn't suitable for everyone, but it's not within the scope of this video to go through a list of all the reasons why someone shouldn't take the pill. Your doctor will go through a thorough list of questions with you before prescribing you any contraceptive. It's also important to note that contraceptives not containing estrogen do not increase the risk of blood clots. These include the progesterone-only pill, also known as the mini pill, the progesterone implant, known as Implanon, the progesterone injections, such as Depo-Provera and Depo-Raloviera, and the intrauterine devices, such as Mirena or the copper IUD. Something that we haven't yet considered is that the risks of the pill need to be considered in the context of its benefits. These benefits include lighter and less painful periods, improvement in acne, the ability to skip or delay periods for important events, the reduced risk of ovarian and uterine cancer, and of course, the prevention of unwanted pregnancy. So in summary, estrogen-containing pills do slightly increase the risk of blood clots. However, that risk is still very small in absolute terms. When prescribed to women with the right health profile, the pill remains a safe and effective form of contraception. To bring back the car analogy that I used at the start of the video, driving a car does increase the risk of having a car accident. However, for the right people, the benefits outweigh the risks.